I'm Tim Smith, and before I start, I want to take a moment to certainly thank the foundation and you, the board, for the time I've had with the fellowship. It has certainly given me opportunities that I wouldn't have had otherwise, and I think that learning Jim Bernstein's vision for healthcare for the state will certainly inform how I lead my professional life from now on. So thank you very much. I appreciate it. My project centered around geo-mapping and population health. What I was looking to do was help a set of residents that are at UNC Family Medicine understand their patient population a little better, a little more quickly. And real quickly, geo-mapping is essentially taking a set of data or sets of data and matching it with geographic features like zip codes or county boundaries. And I can skip that. CHN is part of the statewide HealthNet initiative. So the impetus, again, for my project was to a little background on the relationship with Piedmont Health Services and family medicine. The thought there was, instead of having all 8 residents serve their time at UNC family practice, was to send 2 out to Prospect Hill, which is a more rural clinic run by Piedmont Health Services. And the thinking there was that if someone does a residency in a more rural area, they may be more prone to stay in a rural area. And as you know, we are losing practitioners in our rural areas of the state. Now, some of these folks may have never served in a rural area and certainly hadn't served out at Prospect Hill. So my mentor, who is the director of the partnership, Dr. Evan Ashkin, and I thought that maybe giving these folks a tool to understand their population a little more quickly could get them more comfortable in that setting. So that's what I proposed, and that's what I did my project on. So what I took, how I started this was, I didn't know anything about GIS or geomapping, so I went to UNC Davis Library and met with the Information Sciences Department folks there, and they really helped give me the building blocks to start the process of understanding how to put these maps together. There's a license with S3, which is a company that does this kind of stuff in UNC, and I got the ArcGIS for desktop on my computer and went from there. And once I got more comfortable building these maps, I then created manuals on how to mine the data that you would use and also how to build the maps. And I've got an example here if anyone wants to see it. And then after I built these manuals, I was going to meet with the residents and hold trainings with them so that they could then go back out into their community and build the maps themselves. Now, the residents were very, very interested in this, but there were some limitations. One, residents are residents. They are very busy. They're back and forth between UNC Family Medicine and Prospect Hill. They've got other things going on. So they just didn't have the time to devote to learning this technology. And another thing was that the technology wasn't on their computers, but only mine. And it just didn't work out logistically to try to get that technology on their computer so that they could practice on their own when they're away from me. And again, they may not have had time to actually practice. So my project evolved a little bit. The first thing I thought about was in the best interest for the project was to just centralize the map creation. I knew the technology. I had ownership of it. So the 2 things I did immediately was to create a map request form, and it's still in its testing stage, but also developed a zip code data matrix that if you didn't understand the map making process entirely, it could be sort of a companion to the maps so that you could look at it and understand the maps a little bit better. So here's just an example of the request form, and the idea is that people can fill that out, get it back to me, and I can turn around a map for them. And this is the example of the zip code data matrix, if you'll take a look, the first column is the zip code itself. Second is the population of that zip code. Then this happens to be data for uninsured folks at a particular clinic. So 1,932 folks from that zip code actually go to this clinic. From that zip code, go to that clinic. So that's about 5% of the population of that zip code. Now, 569 of the 1,932 are uninsured. And so of the total population, roughly 1.5% are uninsured in that zip code, but a full 30% of that clinic's population are uninsured. So it's just things like that, and you can do that with diagnoses as well. The further evolutions of the project were I'm working much more with PHS staff rather than the residents. I've worked with Brian Toomey for several projects, a couple clinic managers, and also their nutritionists to try to map out things that they're interested in. And I will continue to work with PHS staff, and not just at Prospect Hill, but across their region. And also reach out to family medicine staff, because several of the folks there have expressed interest in using it and understanding it. And then finally, I do want to understand the capabilities of NC-HIP and the similarities of it to what I'm doing. And NC-HIP, if you don't know, is the North Carolina Community Health Information Portal, and it's the web-based application that CCNC uses. And there are a lot of similarities. It's a very user-friendly website, and I just want to see if what I'm doing can relate to what's going on there. So there are two components of GIS mapping. The first is the data collection to get what you need to use to build the map, and the second is the actual map creation. The first step is just mining data, and I use Centricity, which is the electronic medical record of Piedmont Health Services. And these are just two examples of how I can create a report to get to the data that I need. This is for uninsured at Prospect Hill. This is for diabetic patients at Prospect Hill. And there are a series of steps, but at the end result, you just want to isolate the zip codes that actually have patients that fit your criteria. And then once you have that, you proceed into creating a map. And if we have a moment, I would like to build a map for you. It doesn't take but a few minutes, and I just thought y'all might be interested in seeing the process. So, and I'll just walk through it. The first step is just creating a new file geodatabase. And so as I walk through this, you may understand why it would have been a little bit harder for the residents to come to terms with it. And once you've created that, you import a table. And I think, knowing what I know now, you do have to spend some time with it, but I think it has some real applications too. So I'll just build all patients, and I can add that table in there. Choose sheet 1. And you just simply name what you're looking for, or give it a name that you can easily remember. And this is why I kind of want to learn more about NC-HIP, because I think that oftentimes you can do this with just a click of a mouse button on their website. However, you may not have as much autonomy over what you're getting out of it. Now this should, at the bottom there, table to table, and hopefully, fingers crossed, that will produce a match. And there's table to table. So that table is now joined with a zip code nodes that I have there in North Carolina. Then you just have to go through and join the data to the actual features. And you can do the validate and join. And once you'll see this, you notice that we have 42 zip codes out of a possible 1,590 that match the zip. And then this is the table that actually holds all the zip code information. And we can select. Right. And you'll see that now these are the zip codes that have patients in that area. And in the interest of time, what you create at the end is something that looks like this. So from here, there's a variety of the steps that gets you to here. And so this is all uninsured patients to include, all patients that go to a certain clinic to include all uninsured patients. So you can have two different levels of data that you can see there. And for the nutritionist, I showed him where diabetics were in relation to Prospect Hill, and he was having trouble getting folks from, say, Alamance County to Prospect Hill, and so we decided that maybe it was a better targeted if they came to Charles Drew, another clinic, instead of having to travel that distance. And so we started targeting those patients. So that, in a nutshell, is my project, and I'm continuing to use it for all staff at PHS, family medicine, and I think it's starting to be used more and more, but I just think it's got a lot of utility, and as I learn more and appreciate what the tool can do, I think it'll just be a lot, we'll have a lot more capacity for it.